Intensive care has the sickest patients in the hospital all clustered together in one location. This intensive care unit treats about 1,250 patients a year. A third of these patients are post-operative and have had major cancer surgery. The other two-thirds of the patients are emergency patients from Bristol. The unit itself has 19 beds, but at present they're split in two locations. So we have 13 beds in this location here, but a further 6 beds on the level below in a separate site. One of the benefits of the new intensive care unit will be that those beds are all brought together on a single floor adjacent to theatres, and that will improve the team working and the efficiency of the unit immensely, leading to a much better patient experience. In principle, the main goal of intensive care is to correct abnormality that develops in the patient. And to do this, we have to collect a lot of information constantly about the patient. And these vital signs are usually displayed on a patient monitor, like the one you can see here. And the sort of vital signs that are collected are the ECG, the blood pressure, and the oxygen levels in the patient's blood. However, in this unit, in addition to the monitor, which collects minute-to-minute data, we have an electronic charting system which summarizes the data from hour to hour. And this electronic charting system is what we actually use from day to day to manage the patients and to target and change treatments. So we have built a unique feature onto the monitoring system that you have just seen, and it revolves around this dashboard display on the plasma screen, which summarizes the important vital sign data from each patient. And when you have 19 patients in the intensive care unit, there's a lot of data being generated. And so we use this dashboard to alert us from minute to minute to problems occurring with individual patients. And that's highlighted by the amber and red boxes you see currently on the screen. In reality, we've reached the limit of what we can do with our current system, and we are unable to evolve it any further. The Above and Beyond Charities appeal will allow us to fund a new patient monitoring system to build on what we've done before with this dashboard until we have a truly world-class system which will significantly benefit patients' quality and outcome.
On intensive care ward 3 we have 4 side rooms, 2 of which are double side rooms, or cubicles as you might call them. It would be good to have more side rooms because you can manage infection a lot better. Shirley here is in a side room. She will benefit from the extra privacy and dignity that the side rooms provide. The other bed spaces, which aren't side rooms, are surrounded by curtains. Now these curtains obviously aren't soundproof. They do afford some level of privacy, and we work very hard to maintain that. But obviously with a side room with the glass walls around it, it's just going to be a lot more private. Thanks to this appeal, we'll have much better visitor accommodation. We'll have separate bedrooms for relatives of patients to stay in. So they'll be separate from the waiting areas, so there'll be dedicated bedrooms like these, just to have some peace and quiet away from the unit while they're waiting to see their families. They'll have separate areas where they can sleep overnight if they need to. It's really important that people are able to have that space to just have some peace, really. Whatever comfort we can provide with the new facilities, with more space, dedicated space for different purposes, whether it's for them, the bedrooms for them to sleep in, or the waiting lounges for them to just sit quietly in.
Please support this appeal. Your generosity can really make a difference to help us deliver the very best intensive care to the patients of Bristol and the South West.